Yeah, so regarding the first question, it's it's not important or not. The thing is, the SDGs is rather a reporting mechanism that the member states, including Jordan, is committed to report on the SDG indicators, including the SDG6, which is clean water and sanitation for all. And Jordan as an upper middle income country is doing just fine in terms of the SDG 6.1 and 6.2 and 6.3.1, that is, yeah, around 80s for safely managed drinking water and safely managed sanitation and safely treated wastewater. So it's not a pressing issue, let's say, that is Jordan has to deal with, and it's a nightmare or a panic for the decision maker. We still lack wash services in healthcare facilities, especially PHCs, the primary healthcare centers. You know, those that are, yeah, not as big as hospitals, and they have all the services, and also in schools. Still, some wash services are still not meeting the basic services, you know, for water and for sanitation, also for hygiene. So still things need to, of course, to be improved. Yeah, in all the settings, and especially for to ensure access to all people. So regarding the second question, first is we do not have data on hygiene in Jordan. That is, you know, they didn't include core questions, or the GMP core questions, or the core indicators in one of the surveys or the censuses that is carried out by the Jordan Department of Statistics. The second challenge is, I'll say, it's about the sanitation and the SDG 6.2.1a. It's for the sanitation and the safely managed sanitation, or the sanitation chains. There's two sanitation streams: the on-site sanitation and the off-site sanitation. The off-site is more into the, you know, the conventional sewer system, that contained the wastewater from households and then conveyed into the nearest wastewater treatment plant. And that is okay. We're doing fine in this regard, with the around of 63 or 60, 63 to 67% of all the population in Jordan is connected to sewage system. That is off-site sanitation. The on-site sanitation, on the other hand, is a complete void for us. There's no a very good monitoring in terms of, you know, who's monitoring the septic tanks, the construction of them, who's doing the health inspections to ensure that the fecal sludge or that is contained and then transported or conveyed according to the standards to the nearest wastewater treatment plant. So this is about the on-site sanitation. And finally, when we say it's does the would Jordan reach the 100% of safely managed sanitation in 2030? Well, it's a no, because the dominant intervention for sanitation in Jordan is only connecting people or connecting the households into a centralized wastewater treatment plant, while ignoring, or let's say, yeah, while ignoring the other part is to, to focus more on the decentralized wastewater management. And when you speak about that and with the stakeholders, they say, yeah, we could manage those, but we lack human and financial resources. So it's yeah, I'd say this is the greatest challenge for Jordan in terms of the SDG 6.1, 6.2, and 6.3.1. That is, I'm focusing on that, the WHO scope of work of the particularly SDG 6, not all the SDGs.